Welcome to the 2023 NCLEX Psychosocial Integrity Practice Test. This test will have 40 questions with explained answers that will help you prepare for the test. Be sure to resuscitate the like button by turning it white.
Question 1. Which of the following is not a normal part of aging in the older adult population, 65 plus? A. Decreased sense of smell. B. Decreased balance. C. Sensitive eyes. D. Increased pain perception. The correct answer is D. Increased pain perception. Studies show that after age 70, the older adult tends to see chronic pain as a normal part of aging. They tend to downplay pain as they tend to suffer from situations that they feel are more painful, such as loss of a spouse. Therefore, these patients tend to report pain less often than their younger counterparts. Question 2. A patient presents to the ED with tachycardia, hypertension, and hallucinations. His EKG reveals SVT. The patient's temperature is 100.7. His wife states, he had a seizure that lasted more than 5 minutes before EMS arrived. Which of the following substances can the nurse anticipate this patient will test positive for in his urinalysis? A. ETOH. B. Benzodiazepines. C. Methamphetamines. D. Barbiturates. The correct answer is C. Methamphetamines. Methamphetamines cause excitation of the nervous system. Patients who use meth presents with tachycardia, hypertension, hallucinations, abnormal heart rhythms, and hyperthermia. Seizures are very likely due to the effect that meth has on the nervous system. Question 3. A patient with breast cancer came into her PCP's office and stated that she feels extremely tired and worthless to her kids and husband. She states, maybe they will be better off when I am dead. The nurse understands that the patient needs A. Strong antidepressant. B. A referral to a psychiatrist. C. To be admitted to the hospital for 72 hours. D. To be evaluated for suicidal ideation. The correct answer is D. To be evaluated for suicidal ideation. This patient is exhibiting words of suicidal ideation. The number one concern for this patient is safety. The nurse must ask the patient specifically if she has a plan to harm herself. Question 4. A patient with schizophrenia has orders for haldol IM stat due to extreme aggressive behavior due to hallucinations. When the nurse goes into the patient's room to administer the IM injection, which of the following is the most important for the nurse to ensure safety? A. To take 2 other nurses with them to help hold the patient. B. Leave the patient's door open. C. Speak calmly to the patient. D. Place the patient in restraints before administering the injection. The correct answer is B. Leave the patient's door open. It is important for the nurse to keep their own safety in mind as well. Patients with schizophrenia and other psychotic issues may act aggressive toward staff. It is important for the nurse to leave the door open to ensure an escape route. Options A and C are good practice but are not the most important. Option D is inappropriate without cause and a physician's order. Question 5. A patient who recently started a low dose of a benzodiazepine is at home experiencing a panic attack. The mother calls the patient's PCP and asks what she can do to help her child. What intervention should the nurse educate the mother on? A. Walk with the patient outside in the sun to get fresh air. B. Sit calmly with the patient and provide a feeling of safety and security. C. Distract the patient by turning on their favorite TV show. D. Give the patient a second dose of the benzodiazepine. The correct answer is B. Sit calmly with the patient and provide a feeling of safety and security. When a patient is in panic mode, they will be unable to perform activities. Having them walk or watch television can cause their panic to be worse. Giving a second dose of a benzodiazepine is inappropriate and may cause oversedation. Question 6. A mother who had a newborn 6 weeks ago calls the OBGYN's office and states that her infant never stops crying, the mother is not sleeping or eating, and that she feels overwhelmed because her husband works 12-hour night shifts. Which of the following questions is most important for the nurse to ask the patient? A. Do you have anyone to come over and help you? B. Do you have thoughts of harming yourself or your baby? C. How many times a day is the infant eating? D. Have you thought about coming in for an antidepressant? The correct answer is B. Do you have thoughts of harming yourself or your baby? This mother has stated that she has not slept and she feels overwhelmed. She is exhibiting signs of postpartum depression. Mothers may feel overwhelmed when they have no support system and an infant that seems to never stop crying. These women are at high risk for suicide or harming their infant. The nurse should immediately ask the patient if she has thoughts of harming herself or her baby. Question 7. A patient is admitted to the hospital for complications of her chronic pancreatitis. The patient states that she drinks 12 beers per day, as well as at least a pint of hard liquor most days. Which of the following medications should the nurse anticipate the physician ordering for this patient? A. Methadone. B. Naloxone. C. Naltrexone. D. Librium. The correct answer is D. Librium. Patients who may have withdrawal symptoms from alcohol can be prescribed Librium in the hospital to hinder withdrawal symptoms. Methadone is given to patients who are addicted to opioids. Naloxone is given to a patient who has overdosed on opioids. Naltrexone hinders the patient from feeling pleasure when drinking alcohol, but does not help with withdrawal symptoms. Question 8. A patient with a history of ETOH abuse is being discharged from the hospital. She states that she is currently still drinking heavy liquor throughout the day and wine at bedtime. Which of the following does the nurse anticipate being a part of the patient's care plan upon discharge? A. Education for the patient on how to drink alcohol in moderation. B. Prescription for naltrexone if needed. C. Psychiatric therapy for the patient to help them drink alcohol in moderation. D. Educate the patient on how to increase their self-control. The correct answer is B. Prescription for naltrexone if needed. This patient states that she is drinking alcohol heavily. Naltrexone is prescribed to help patients not find pleasure when drinking alcohol. This medication may be given to help the patient stop drinking alcohol. Therefore, the nurse can anticipate it being a part of the discharge plans. Patients who are alcoholics are not able to drink alcohol in moderation or use self-control to keep from drinking alcohol. Therapy may be needed for this patient, but is not the most likely to help the patient quit drinking in the near future. Question 9. A 30-year-old patient's mother joins him in his PCP's office for an appointment for evaluation of psychotic symptoms that the patient has been experiencing. The mother states that she has noticed that the patient is very withdrawn when around others. He is beginning to make up words that make no sense to her and has been laughing very loudly at random. Which of the following diagnoses does the nurse anticipate for this patient? A. Disorganized schizophrenia. B. Bipolar I disorder. C. Generalized anxiety disorder. D. Cyclothymia. The correct answer is A. Disorganized schizophrenia. Patients with disorganized schizophrenia are often withdrawn socially. They make up words that make no sense to others and may laugh loudly randomly or at inappropriate times. Bipolar I disorder refers to patients who have had manic episodes for at least 7 days in which they need immediate medical care. The patient may experience both manic and depressive episodes with bipolar I disorder. The hallmark of generalized anxiety disorder is excessive concern over commonplace problems and circumstances that endures for more than 6 months. This worry causes physical issues for the patient like muscle tension and headaches. Cyclothymia is a disorder in which the patient experiences ups and downs, but is not as severe as bipolar I or II disorder. Question 10. A 14-year-old girl reports that she feels very ashamed after she binge eats, so she takes many laxatives to offset what she eats. When the nurse assesses the patient's teeth are yellow and chipped, which of the following does the nurse anticipate for this patient? A. Anorexia nervosa. B. Bulimia nervosa. C. Binge eating disorder. D. Restrictive eating disorder. The correct answer is B. Bulimia nervosa. Bulimia nervosa is identified when a patient binge eats, usually for emotional reasons, and then feels guilty and ashamed that they ate as much as they did. The patient decides to induce vomiting or takes laxatives and/or diuretics to lose the weight that they think they have gained. Question 11. A patient is newly diagnosed with Alzheimer's disease. This patient often experiences memory loss and takes longer to complete normal tasks. Which of the following should be included in this patient's plan of care at home? A. Frequent reorientation. B. Behavior therapy. C. CRT, cognitive remediation therapy. D. Social intervention. The correct answer is A. Frequent reorientation. A patient with Alzheimer's disease is a disease in which patients' minds decline more and more over time. It leads to memory loss and causes the patient to take longer to perform everyday activities, even if they have performed them for years. The patients need frequent reorientation to person, place, and time. Question 12. A parent brings their 7-year-old child with ADHD to the pediatric office for a well child checkup. Which of the following interventions will be best for this patient? A. Have the patient make the child sit as still as possible. B. Allow the child to fidget as much as they need. C. Give the child a toy to make them sit still. D. Allow the child to run around the office to run out their energy. The correct answer is B. Allow the child to fidget as much as they need. Children with ADHD should not be made to sit still. Giving the child a toy will not make a child with ADHD sit still. It is not necessary to allow the child to run around the office. Simply allowing the child to fidget as they need is sufficient. Question 13. A mother presents to the pediatrician's office concerned for her 5-year child with ASD, autism spectrum disorder. She states that her child will start kindergarten in 2 weeks, and she is afraid that her child will not cope well. Which of the following may the nurse suggest to best help the child? A. Tell the mom to explain to her child that she will love her new teacher. B. Ask the mom if she has considered homeschooling her child. C. Tell the mom that it is best to let the child tour the school, especially the classroom, and meet the teacher before starting the first day of school. D. Encourage the mom to make a set bedtime for her child as kindergarten approaches. The correct answer is C. Tell the mom that it is best to let the child tour the school, especially the classroom, and meet the teacher before starting the first day of school. When a child with ASD has their schedule interrupted, it can cause a significant amount of stress. Encouraging the mother to take the child to meet her teacher and see her school and classroom beforehand may make the first day of school a lot easier on the child. The mother simply telling the child with ASD that she will love her teacher is inappropriate, because a child of kindergarten age will not understand that reasoning. Option B is inappropriate. While the child may thrive on a set bedtime, this will not necessarily help calm the child's anxiety about school. Question 14. A father brings his 4-year-old daughter to the pediatrician's office due to concerns of the patient bedwetting after being potty trained for a 1.5 years with no nighttime accidents. The father states that he has a newborn at home as well. Which of the following statements by the nurse is correct? A. She may need a bladder evaluation since she is bedwetting. B. We should assess her for a urinary tract infection. C. It is normal for children to regress when they experience a big life change such as a new sibling. D. Putting your daughter in pull-ups overnight may be helpful. The correct answer is C. It is normal for children to regress when they experience a big life change such as a new sibling. It is important for the nurse to assure the father that as children go through major life events, like having a new sibling, the child may regress. Putting the child in pull-ups overnight does not encourage the child to not urinate in bed. Question 15. A patient that was involved in a motor vehicle accident, MVA, as a child. As an adult, the patient gets extreme anxiety when in a vehicle. Which of the following is the patient exhibiting? A. Denial. B. Stubbornness. C. Repression. D. Displacement. The correct answer is C. Repression. This patient is experiencing repression. Repression happens when unwanted thoughts or urges are subconsciously blocked. Even if a person has no memory of a traumatic experience, they may still have this protective mechanism even though they were awake and aware at the time. Question 16. A woman presents to the ED stating that she has been raped. She exhibits high anxiety and fear. Which of the following is most important for the nurse to provide this patient? A. The nurse should encourage the patient to tell authorities who the offender was. B. The nurse should provide a sense of trust and safety through care provided. C. The nurse should encourage the patient to not have contact with the offender. D. The nurse should provide a consent form to the patient so that the sane nurse can evaluate her. The correct answer is B. The nurse should provide a sense of trust and safety through care provided. When a patient is fearful and anxiety-ridden, the nurse should make the patient feel safe. The other options may be appropriate at one point, but they are not the priority for this patient. Question 17. A patient presents to her PCP's office and states that she feels excessively sad, is restless and irritable, has lost 10 pounds due to poor appetite, and has had a headache almost every day. She states that she has been feeling this way for about 3 weeks now. Which of the following diagnoses can the nurse anticipate? A. GAD, generalized anxiety disorder. B. Major depression. C. Bipolar Y disorder. D. Sensory processing disorder. The correct answer is B. Major depression. Major depression is diagnosed when a patient has 5 or more symptoms of depression every day or at least 2 weeks. Symptoms may include poor appetite, irritability, headaches, feelings of excessive sadness, and restlessness. Question 18. A nurse is caring for a patient with dementia. The patient states that her deceased husband is on his way to see her and take her on a date. She is putting on her makeup and brushing her hair. Which of the following statements by the nurse is not appropriate for the nurse to say? A. I see that you are very excited about seeing your husband. You two must have lots of fun together. B. Oh, honey, your husband isn't coming. He passed away several years ago. C. Your makeup looks so beautiful. Would you like to go to bingo with some of the other residents? D. Can I help you with your hair? The correct answer is B. Oh, honey, your husband isn't coming. He passed away several years ago. It is not appropriate for a nurse to remind a patient that a family member has passed. It is also inappropriate for a nurse to remind a patient that they are forgetful. Distracting the patient is a good option. Question 19. A patient with dementia is hospitalized with a urinary tract infection, UTI, and confusion. The patient is found walking in the hallway in her hospital gown with her buttock visible to staff and others. Which of the following is the best intervention by the nurse? A. Tell the patient that she must return to her room immediately. B. Tell the patient that you will need her to return to her room or you will have to restrain her. C. Help the patient back to her room, ask her if she would like to watch TV. D. Call the physician for an antipsychotic. The correct answer is C. Help the patient back to her room, ask her if she would like to watch TV. The patient is experiencing psychosis. The nurse may not be able to reason with the patient and may instead make the patient more upset. Calmly walking the patient back to her room and distracting her with the TV may be most helpful. Giving a wandering patient an antipsychotic is inappropriate. Question 20. A patient presents to the clinic with his wife. The wife states that she has noticed confusion, dilated pupils, and intense emotions in her husband. She states that the patient has been complaining of very vivid nightmares. Which of the following substances would the nurse anticipate the patient is using? A. Marijuana. B. LSD, D-lysergic acid diethylamide. C. Opioids. D. Benzodiazepines. The correct answer is B. LSD, D-lysergic acid diethylamide. Symptoms of LSD use include confusion, dilated pupils, and intense emotions. It may also include very vivid nightmares, insomnia, confusion, chills, etc. Marijuana use may cause drowsiness, dry eyes, fatigues, and headaches. Opioids may cause euphoria, nausea, drowsiness, and a decreased respiratory rate. Benzodiazepines may cause drowsiness, slurred speech, muscle weakness, and memory issues. Question 21. A patient with bipolar Y disorder is being discharged from the hospital for the 3rd time this year. The husband inquires about advice to help keep the patient from being readmitted to the hospital for her diagnosis. Which of the following should the nurse educate the patient and her husband on to keep the patient from being admitted again for her diagnosis? A. Tell the patient's husband that he needs to keep the patient from stress. B. Educate the patient and her husband on the importance of taking medications as prescribed. C. Tell the patient that she needs to follow a very healthy diet to encourage a healthy brain. D. Educate the patient about reaching out to a support group. The correct answer is B. Educate the patient and her husband on the importance of taking medications as prescribed. Oftentimes, patients with bipolar I disorder and other psychiatric disorders are readmitted to the hospital multiple times a year due to medication non-compliance. The best intervention in this scenario is to have the nurse educate the patient and her husband on the importance of taking her medication as prescribed. Question 22. A nurse is educating a UAP on therapeutic communication. Which of the following is not an example of therapeutic communication by the nurse? A. Asking why questions. B. Asking the patient how they are feeling. C. Active listening. D. Using touch. The correct answer is A. Asking why questions. The use of therapeutic communication in patient encounters is very beneficial and cross-disciplinary. The interprofessional team's involvement in enhancing patient care through the use of therapeutic communication is discussed in this exercise, along with the history, definition, and applications of therapeutic communication. Examples include asking a patient how they are feeling, active listening, using touch when appropriate, sharing empathy, and using silence. Asking why questions is not therapeutic and can often upset the patient. Question 23. A mother is concerned about her 14-year-old daughter. She states that her daughter is exhibiting signs of self-harm. Which of the following may the patient exhibit with NSSID, non-suicidal self-injury disorder? A. Being defiant and sneaking out. B. Wearing long sleeves during the hot summer months. C. Drinking alcohol with friends. D. Decreased grades in school. The correct answer is B. Wearing long sleeves during the hot summer months. A patient who exhibits NSSID will wear long sleeves year-round to cover evidence of self-harm. For example, many teenagers who cut their arms will wear long sleeves to hide the evidence of self-harm to their parents and peers. Options A, C, and D are things that typical teenagers may encounter. Question 24. A 25-year-old woman who was recently in a car accident has recently undergone a BKA, below-the-knee amputation. Which of the following actions by the patient indicates ineffective coping? A. The patient states that she is just ready to leave to see her husband and children. B. The patient refuses to look at her leg. C. The patient cries as she speaks to her husband about losing her leg. D. The patient states that she is worried about her life as she goes home. The correct answer is B. The patient refuses to look at her leg. This patient has just undergone a traumatic car accident and traumatic experience of losing her leg. It is normal for a patient to be in denial initially. This patient is experiencing denial and ineffective coping by not acknowledging her leg is gone. It is normal for the patient to be ready to leave the hospital to see family, cry when grieving her loss, and having anxiety about her new life after trauma. Question 25. A patient is admitted to the ICU after being in a boating accident where he was severely injured. His mother is at the bedside and asks him about the accident. The patient states, "What accident? I'm fine, Mom." Which of the following is the patient exhibiting? A. Suppression. B. Repression. C. Denial. D. Displacement. The correct answer is A. Suppression. Suppression involves blocking unwanted thoughts or urges by purpose, as opposed to repression, which is a subconscious process. Someone who experiences intrusive thoughts about a terrible occurrence but pushes these ideas out of their mind may have this defensive mechanism. This patient is pushing the thought of his boating accident from his mind. Question 26. A patient who is intoxicated in the ED states to the nurse, "You're so beautiful. Let me take you out on a date, baby." Which of the following is the best response by the nurse? A. Tell the patient that he will be reported to the doctor if he does not knock it off. B. Explain to the patient that his words are inappropriate for the nurse-patient relationship. C. Tell the patient that you two can discuss his feelings at a later time when he is not intoxicated. D. Explain to the patient that he is intoxicated and that he does not mean what he is saying. The correct answer is B. Explain to the patient that his words are inappropriate for the nurse-patient relationship. The nurse should let the patient know immediately that his words are inappropriate and will not be tolerated. It is unnecessary to explain to the patient that he is intoxicated. Question 27. You are the charge nurse on a medical surgical floor, handing out assignments for the shift when another nurse states, "I am not taking care of that patient in room 18 with HIV." Which of the following should you ask the nurse concerned about working with a patient with HIV? A. What do you know about HIV? B. Why do you have an issue taking care of this patient? C. What is the issue here? All you have to do is wear your correct PPE. D. Can you please explain to me why this patient is an issue for you? The correct answer is A. What do you know about HIV? Asking the nurse what she knows about HIV can open a discussion for education for the nurse. It is inappropriate for nurses to refuse patient assignments based on the patient's diagnosis. The charge nurse should explore why this nurse is opposed to caring for this specific patient. Question 28. A psychiatric patient admitted to the hospital states, "Are we at my house? I am not going into that room. He will not hit me anymore." Which of the following is the best response by the nurse? A. I sense that you are scared. We are at the hospital at St. Joe's, not at your home. B. Who is hurting you? You don't have to worry about them. You are safe with me. C. I won't let him hurt you. You are safe with me. D. You are the hospital. No one is going to hurt you. The correct answer is A. I sense that you are scared. We are at the hospital at St. Joe's, not at your home. When a psychiatric patient is experiencing confusion and psychosis, it is important to reorient them to where they are. Options B and C play into the patient's psychosis. Option D dismisses the patient's feelings and offers false hope. Question 29. A patient who is post-op from a BKA states, I know that it sounds stupid, but I am afraid that people will stare at me in public since I lost my leg. What is the nurse's best response? A. It is normal to have these concerns. Do you want to talk more about how you are feeling? B. Oh, honey, no one really cares about your legs. You're beautiful no matter what. C. It will be hard when they stare, but you're strong. D. Don't worry. Once you get your prosthetic, no one will even notice. The correct answer is A. It is normal to have these concerns. Do you want to talk more about how you are feeling? It is important for the nurse to be kind and understanding how a patient feels after losing a body part. Option A offers support. Options B, C, and D dismiss the patient's feelings completely. Question 30. A patient is admitted to the hospital after an accident that left him bedridden. He stated earlier in your shift that he is used to providing for his family as his wife stays home, homeschooling their 3 children. He later begins yelling, I don't want your help. Just please leave and leave me alone. I do not want you doing anything for me. Which of the following does the nurse suspect the patient to be suffering from? A. Depression. B. Non-acceptance of a situational role change. C. Poor self-control. D. Anger after a significant life change. The correct answer is B. Non-acceptance of a situational role change. The patient is used to providing financially to his family. He is having trouble adjusting to the fact that he is bedridden and his wife is having to take on his role. Yelling and not letting others help is a sign that the patient is experiencing non-acceptance of a situational role change. Question 31. A patient in the ED has learned that his brother passed away after they were in a MVA. The patient grabs the chair and throws it across the room. Which of the following is the patient using as a defense mechanism? A. Regression. B. Projection. C. Displacement. D. Sublimation. The correct answer is C. Displacement. Transferring one's emotional load or response to another entity is known as displacement. If a person has a difficult day at work and then snaps at their family at home, this coping technique can be present. Question 32. The nurse is attempting to reorient a delusional patient. Which of the following is inappropriate for the nurse to focus on during an attempt to reorient this patient? A. Current time. B. Last time the patient had his antibiotic. C. Today's date. D. The patient's location. The correct answer is B. Last time the patient had his antibiotic. When attempting to reorient a delusional patient, the nurse should focus on the current time, the date, and the patient's location. Knowing the last time the patient had his antibiotic is not necessary information in reorienting the patient. Question 33. A patient is diagnosed with Wernicke-Korsakoff syndrome due to a lack of thiamine. The nurse knows which of the following patients is at the highest risk for Wernicke-Korsakoff syndrome. A. A patient receiving chemotherapy. B. A patient with ETOH abuse. C. A patient with dementia. D. A patient with bulimia nervosa. The correct answer is B. A patient with ETOH abuse. A patient who abuses alcohol is usually deficient in thiamine. If left untreated, a thiamine deficiency may lead to Wernicke-Korsakoff syndrome. This is a neurological disorder that causes encephalopathy, confusion, ataxia, nystagmus, and alcohol withdrawal symptoms. Question 34. A patient that is on a medical surgical unit states that she usually takes alprazolam at home to calm her nerves, although her physician does not prescribe it to her. She states that she usually takes 3 1-milligram tablets daily. Which of the following is the most appropriate intervention by the nurse? A. Collect a urinalysis. B. Contact the physician. C. Tell the patient that she will not be ordered a benzodiazepine in the hospital. D. Ask the patient if she drinks alcohol daily. The correct answer is B. Contact the physician. This patient is on a very high dose of alprazolam, Xanax, daily. If she is without benzodiazepines for an extended amount of time, she will experience withdrawal symptoms. The physician should be promptly notified so that they can make a decision on whether to order a benzodiazepine to keep the patient from having withdrawals. Question 35. A patient being discharged with wound care orders from the hospital has a poor socioeconomic status, a history of non-compliance, and had a husband that recently passed away suddenly. Which of the following is the patient most at risk for? A. Suicidal ideation. B. Low self-esteem. C. High risk of non-compliance with treatment. D. Depression. The correct answer is C. High risk of non-compliance with treatment. This patient has a history of non-compliance with treatment. This puts her at a high risk for non-compliance after discharge. While the patient A be at a risk for depression and suicidal ideation, there is no evidence that she is experiencing these symptoms. Question 36. The home health nurse is visiting a patient's home. The patient is an 87-year-old with dementia, hypertension, COPD, and emphysema, and she requires oxygen. The patient's daughter is not home. As the patient and the nurse are alone, the patient states, "Sometimes my daughter forgets I'm here and I don't get my medications and sometimes skip meals. She doesn't mean to. She just forgets sometimes." Which of the following is the best intervention by the nurse? A. Ask the patient when the last time she had her medications and a meal. B. Report this to the physician immediately. C. Report the patient's allegations to APS promptly. D. Check the patient's vital signs. The correct answer is B. Report this to the physician immediately. This patient is at a very high risk for older adult abuse. This patient has dementia and may be forgetful, so the nurse should not jump to conclusions. However, the patient's allegations should be taken very seriously. Reporting this to the physician should happen first. Question 37. Your patient is on a pescatarian diet. Which of the following should not be included on the patient's lunch tray? A. Eggs. B. Milk. C. Fish. D. Beef. The correct answer is D. Beef. Pescatarianism is the practice of including seafood in a diet that is primarily vegetarian. Other animal items, such as eggs and dairy, are optional for pescatarians. Question 38. The daughter of a patient with Alzheimer's disease states that she has noticed that her mother has begun denying food and having trouble swallowing food when she does eat. She states, she has had pneumonia 3 times this year alone. Which of the following comments by the nurse is correct? A. These are symptoms of late-stage Alzheimer's. It is important that you have a support system in place at this time. B. Your mom will improve over time. This is just a bump in the road. C. I suggest that we ask the doctor to place a PEG tube for nutrition. D. The doctor may need to change her antibiotic. She may be experiencing antibiotic resistance. The correct answer is A. These are symptoms of late-stage Alzheimer's. It is important that you have a support system in place at this time. The nurse should not offer false hope like in option B. The nurse should let the daughter know that the patient is in the late stages of Alzheimer's and what to expect, including death. The daughter will need some sort of support system because Alzheimer's is a disease that makes the patient's family slowly watch them die. Option C should not be a suggestion because this is the physician's role. Oftentimes, placing a PEG tube will only prolong a patient's life, not add quality of life. Option D is inappropriate because changing an antibiotic does not help Alzheimer's symptoms. Question 39. The nurse is caring for a resident in a long-term care facility who often experiences nighttime agitation. Which of the following would best benefit the resident? A. Allow the patient to take several naps during the day to catch up on sleep. B. Encourage the family to visit the resident for most of the day to keep the resident awake. C. Ensure the resident stays up in his wheelchair for most of the day. D. Schedule multiple activities during the day for the resident. The correct answer is D. Schedule multiple activities during the day for the resident. This patient needs help sleeping at a normal bedtime instead of being agitated all night. Scheduling activities for the patient to do will help keep the patient on a schedule and keep the patient from sleeping during the day. It is not okay to keep the patient in his wheelchair all day because he may get a decubitus on his sacrum. Further, he may still fall asleep in his wheelchair. Question 40. You're an ER nurse assessing an elderly adult patient with bruises that are in different stages of healing. Her caregiver is at the bedside as well. What is your most important intervention? A. Report the bruising to the physician. B. Document the bruising in the patient's chart. C. Ask the patient where she obtained the bruising. D. Ask the patient's caregiver where the patient got the bruises. The correct answer is A. Report the bruising to the physician. Bruising in different stages of healing often means that the patient is being abused. This should be reported to the physician immediately.
Thank you for watching this video. We hope you enjoyed it. Click the first link in the description to take the free NCLEX practice test. Also, check out these videos that can help you with your future studies. Don't forget to resuscitate the like button and subscribe to our channel, and please share this video with your fellow nursing friends.